Hi, everyone. Welcome to our January edition of Poderosas to the Front. I'm thrilled to be here today with Maria to talk to you all about Cervical Cancer Awareness Month. Maria, do you want to take a moment to introduce yourself and talk about the amazing work you're doing as a Latina Ambassador with Cervivor?
Oh, hi, everybody. My name is Maria Franklin. I am a cervical cancer survivor, diagnosed when I was 27 years old, so almost 20 years ago. Right now, I do work very closely with other cervical cancer survivors through the organization Cervivor. And we're just dedicated to eliminating this cancer and providing education and resources to the community so that they know what they need to do to prevent the cancer that we went through and that nearly killed us. For me particularly, I do have a passion for helping the Latina population. I know what the issues were that affected me, why I didn't get to the doctors on time, and I just want to make sure that doesn't happen to other women.
Yeah, well, thank you. Women. Thank you so much for sharing your story with us today, and for all the great work that you're doing. So I just kind of want to dive right in and chat a bit about why do you think Latinas face the highest cervical cancer rates and Black women the highest mortality rates?
Oh, I think one of the big issues is the stigma that goes along with HPV and who gets HPV and not knowing exactly what HPV is. Another thing I'm going to say here in the United States in particular, I'm going to say is access to care, accessing the providers, having the right insurance to go to the providers, having the right places to go, and then knowing the guidelines or when they need to get screened. I think there's a lot of cultural issues too that prevent us from going to the gynecologist on time. Especially for single women, for single Latina women, that's a huge issue. And I know that was one of the issues for me back in the day. I was a single woman in a very conservative home, in a very religious home. So sex was not happening. So I couldn't get to the gynecologist because then I would have been outed. So, so those are some of the things. And I'm going to say here too in the United States, I also got to say language is an issue because sometimes we have a very we have difficulty expressing what our symptoms are, communicating them effectively, and they may be brushed to the side and not paid as close attention as the doctor should if we were able to communicate properly or describe them properly.
Yeah, absolutely. I think you touched on a lot of issues where, like, we know Latinas are the most uninsured population in the United States. So it's not only just about being able to get in the door of your doctor, but once you get in the door, does your doctor speak your language? Can you communicate your needs? Just what you said, like to the fullest extent to make sure that you're getting the care that you deserve. I feel like it's multiple barriers. And we know that cervical cancer is a highly preventable disease, but getting to those services to make it preventable is really a challenge for the community.
Absolutely. Getting access to services is going to be a huge barrier here. And you have one of those barriers puts your life at risk. But for us Latina, we have many barriers to access the care.
How do you see cervical cancer as being able to be prevented?
Oh, cervical cancer is one of the most easily preventable cancers. First of all, you have the Pap smear, and which has been around forever. So if you go to your doctor regularly and have your Pap smear regularly, with the HPV test, because HPV is linked to cervical cancer. If you have those regularly, then you should be able to catch any changes in the cervix on time. So that will help you prevent cervical cancer. But most importantly, I would say is the vaccination. If we vaccinate the next generation, all the kids that are growing up right now, if we vaccinate them against HPV, we shouldn't be seeing this cancer at all. Because the majority of them are caused by cervical cancer. So I don't know, we've been praying for years and years for a cure to cancer. We have a vaccine that can prevent the cancer. So we should use it. We should
Absolutely.
definitely use it.
And I feel like a lot of people too don't know that you can be vaccinated regardless of your gender. So it's something that all people can get if they're in the right age group to prevent the disease.
Right. Absolutely. Yes. Every boy and every girl should get that vaccine. And everybody that's still in the age, right? Recently they extended it to 45 years old, I believe. So yeah, I would be running to the doctor to get it. Because if you haven't been exposed to this virus, then you still have a chance.
Yeah. What are some common myths that you've heard regarding Latinas and cervical cancer?
Oh, I think the biggest issue right there is who gets HPV. I still hear, well, a lot of women don't know about HPV, and I'm very surprised about that. But it's still happening. A lot of women have never heard about HPV. They don't know what it is. They don't know how it's transmitted. And there's also the stigma that HPV, well, it's you get it because you're a bad girl or you've slept around, and that is not true. That is not necessarily true. You can have one partner, and if that partner has been exposed to HPV, you will be exposed to HPV. And I think that is very important for Latinas to know, because I think we guard our reputation so much, and especially in our Hispanic communities, that we just believe that, well, if I'm only with one person, that's never going to happen to me. But it has happened to other people, and we have seen those cases. So we just need one infected partner. So that is a huge myth, and that needs to end. Like, people need to know this is a very dangerous virus. Almost everybody has it or will be exposed to it at some point in their life. And because it doesn't have any symptoms, you might not even know that you have it or that your partner has it. So you have to be aware that it can happen to anybody, and you have to be diligent then with your care and with a vaccination that you're going to need to prevent it.
And like you said, with not having any symptoms, the most way to really stay on top of it is with pap smears and going to the doctor regularly to make sure that you are monitoring any changes in your body.
Yes, and another thing I will say, because there has been cases of people that have gone regularly to their doctor in between periods, then in between one year and the other, they have developed the cancer. If there's anything in your body that is not right or doesn't feel right, you go to your doctor right away. You find your doctor and you communicate those symptoms.
Yeah. I feel like it's important to mention too, we'll get into it more a little bit later with what legislative and policy fixes we see, but Title X clinics are a great resource for people who are uninsured of any documentation status to be able to go and receive pap smears either for free or at a discounted rate. So I feel like another part of it is it's really important for people to know where they can access services if they don't have insurance or if they're unable to pay at this time. Absolutely.
There's the local community clinics that you can go and access care there, regardless of your status, and that is of extreme importance. And I think it's extremely important that those don't go away or go unfunded, because a dose of prevention is going to save a lot of money in the end. If we can prevent the disease, we'll save a lot of money that we're going to be spending on treatment and follow-up care for the rest of their lives, because our cancer doesn't end when our treatment ends. Like, we are going to live with the symptoms for the rest of our lives, with long-term side effects for the rest of our lives. That's a lot of money that's going to be spent on healthcare, that if you invest in it in the front end, then your prevention is important. So those clinics should be funded, in my opinion.
Do you feel comfortable sharing with us a bit about some of the side effects you experienced or your story more broadly?
Oh, absolutely. So I'll tell you a little bit about my story then. So I was diagnosed at 27. Sadly, I had not been to the doctor for a pap smear. I had been going to my regular doctor. And as soon as I was starting to have some symptoms, like I was having vaginal discharge, he believed it was an infection, but I never got a referral to go to the GYN, and he's my primary care doctor, so he wouldn't know that I should go or not, but he didn't. And one of the things that he later said, he didn't realize that I was active, but I don't understand that. I was 27, but whatever. So anyway, so once I got diagnosed, it was treated with radiation, internal radiation and external radiation, and also with chemotherapy. Those treatments come with a lot of side effects, especially the radiation. Because of the radiation, I am unable to have children of my own. I will never be a mom. And that was horrible to hear at 27 when you want to have a big family. I wanted to have a huge family because I was an only daughter, so I always wanted that. That was taken away from me because of this cancer and the treatments that I needed to go through to save my life. That chance to be a mother went away. Years later, I am still struggling with issues related to the colon, to the bladder, and it's all related to the radiation. Also struggle with neuropathy. I have osteopenia, which comes before osteoporosis. There's a lot of little side effects that you don't even think that are related, but in the end, they are related. Recently, about a year ago, and again, I'm only almost 20 years out of my treatments. About a year ago, it was found out that my ureters were causing blockages because of the scar tissue of the radiation has caused. So, Leo, that urine is going back to the kidneys. That can have an adverse effect on my kidneys. I've been lucky that nothing major has happened and that we have been able to treat it with a medication. That is a huge risk. So, and who knows what else is going to pop up in the future.
Yeah. And thank you for sharing the details of your story with us today. And I think, to your point, it really emphasizes the importance of having access to the care we need in the language we need it in throughout the course of our lives, not just when facing the disease immediately, but to support all of the consequences that can come after.
Mm-hmm. I'm going to say when we talk about the languages and the language barrier and communicating with the doctor, it's super important that women know that they can ask for a medical interpreter. That should be part of your, I don't know, anything legal, and with a doctor, you should have an interpreter with you so you can communicate your needs.
Yeah, when we talk about like what are the legislative or policy fixes, we know currently under the ACA, providers are required to provide services in the language that a person needs and materials in the language a person needs. But the current attacks that we're seeing from the administration, make us really worry about how these may be pulled back, and just how important it is that the administration and members of Congress really protect the language access protections that we do currently have. And again, I mentioned Title X family planning providers before, and you mentioned community health centers, and just the importance that they do provide language access, required to provide language access. And so the importance of funding these centers is just so critical for people to access the care that they need.
No, absolutely, and I think we get hung up on like pieces of the services that these clinics provide, and we forget about all the other services that are life-saving services. Like women need their screenings. It's what's going to save our lives, to be able to access that care, to be able to get our PAP and HPV tests and our vaccinations on time. That is going to save our lives, and it's going to save money. It's going to save money.
And in speaking of barriers to care too, we know that cervical cancer also disproportionately impacts the LGBTQ community, with discrimination against trans individuals, and barriers to care when you're, in addition to language access and other barriers and uninsured rates.
It's super important that we self-advocate as our body, and we need to take care of it, and we need to access the providers that are able to provide the care that we need. We shouldn't be hiding.
Yes.
We shouldn't be hiding when we have these symptoms. We should, or or to access preventive care, we shouldn't be hiding. We should be able to access everything, every service that we need freely.
Mm-hmm. I think one thing that's really important too in accessing care is having a trusted provider. You mentioned being able to speak to them in a way that reflects your needs, but also, we're seeing on the state level restrictions in the Medicaid program with people not being able to go to the doctor of their choice because of different providers being excluded from the Medicaid program. So not only is it important that people are able to get to the doctor, but that they're able to get to the doctor that they feel most comfortable going to and that they can communicate most freely with.
And I think that it's a huge piece of self-advocacy that we have to take on ourselves. If we're attending appointments with a doctor that is not listening to us, and we're experiencing whatever symptoms we're experiencing, or trying to access tests because we need it, or we're due for a PAP or something like that, then we need to advocate for ourselves and find a different provider, and just find a health navigator or somebody that'll help us do that.
Absolutely. And the navigators that are able to help sign people up for health insurance are really critical for kind of connecting those dots and helping people get the coverage they need for the services they need. Which goes to my last question, kind of what are the legislative fixes, or what are the policy fixes? And I know at NLIRH it's really important for us to have the Affordable Care Act robustly enforced the way that it was intended to be. So having those grants for navigators to help sign people up for insurance and have all the protections for language access and non-discrimination provisions, so all people with cervixes can get the pap smears.
Absolutely. Absolutely, we need to have the right funding for all these services and all these clinics that provide the services to the community. We shouldn't be limiting access to these communities. We're not going to go away. We're here. We can't wait till we get sick then to access the care. I always put a big emphasis on the cost, because government is so worried about cost. Then you invest in the prevention, and the prevention happens in these clinics where you fund, when you fund these clinics where people can have access on time, and that will end up saving money in the long term.
Absolutely. I know another thing we really advocate for is the expansion of Medicaid in states. So more people can be eligible for coverage. So again, more people can be eligible to access the services they need. And we know that large portions of the Latinx community live in states that haven't expanded coverage. So that means that they're also not getting the coverage and care that they need.
In that sense, then you're going to have to write to your representatives for sure and make sure that that happens in your state.
Absolutely. What other sorts of things do you want to share with our audience today, either as your work as an ambassador or other things you want people to know?
Oh, I think the most important people that I want the Latino women to know is that HPV can happen to anybody. You can be married to the one person, and you had married your one and only, and if he has ever been exposed to HPV, you will be exposed to. So you need to be vigilant about your own health. Any symptoms, go to your doctor. Get the HPV vaccine if you still are within the age range that you can get that. Vaccinate your children. That is going to prevent not only cervical cancer, but other type of cancers as well, including some cancers in males. I think it's a big miscommunication with. I come from a very Christian home, and our Latino communities tend to be very Christian oriented. Christian women need to know that this happened to them too, that this can happen to their children too. This doesn't just happen to everybody else but my kids. It can happen to anybody. So you need to protect your kids against HPV, and you need to take care of yourself as well and ask for that HPV test. Unfortunately, there's no test for males, so we have to do what we have in our hands and in our part then, and access to the pap smear and the HPV test. If you haven't had your pap smear in years, and I hear this a lot from, especially from young women, because they're so dedicated to their kids and their appointments for their kids and their activities and everybody else in the family that they forget about their own appointments. It doesn't matter if it's been 6-7 years, call your doctor and make that appointment, or go to your local clinic and make that appointment. There's resources out there. If you don't know how to access it, just connect with one of the local clinics, so with a navigator on that clinic, so they can help you navigate the system and get to that, to your provider that's going to need to see you to get that pap smear scheduled. If you have health insurance, contact your health insurance then, and a lot of them have staff that will help you find a provider. So definitely use the resources that you have at your hand. Make your appointment, go and get that pap and HPV test, and take it from there. Your doctor will tell you what the next step is, and how frequently you need to get it. But make that first step and do it now. You don't want to get this cancer. Nobody should be getting this cancer anymore.
Absolutely. I feel staying vigilant and staying on top of it as much as you can is just allows you to know what's going on with your own body. I think the point you brought up too. Oh yeah, go ahead.
Oh, we know our own bodies. We definitely know our own bodies. When prior to me being diagnosed, I do remember I had very abnormal bleeding, and I had presented to the ER. And the doctor sent me home stating that that was my period. I've been having my period for so many years. I know what my periods look like. That was not my period. And just basically brushed me away. That's your period. You need to go home. But it wasn't. And a week later, I landed in the ER again. And getting a diagnosis of cervical cancer, because finally I found a doctor that actually helped me or heard me and did the pap smear and did everything that he needed to do. But the first doctor that saw me at the ER, he just brushed it away. So we know our bodies. We know what is normal for us and what isn't. And if somebody's not hearing you, then you go to the next one. But you get heard. You have to be heard.
And I feel like it's just so important because nobody else is going to advocate on your behalf, which is kind of a hard pill to swallow, but it's just what you said. It's like if somebody isn't listening to you, like your health is so important to find the right provider that will. And obviously there's challenges for people living in rural areas or people without insurance. So it's not just to say like, oh, go find a new provider in a way that dismisses the barriers, but also just emphasizing how critical it is that people have a provider that they're comfortable with and that they feel like is really listening to their issues. Because like you said, you know our own bodies, and we know when something isn't right.
Absolutely.
I feel like the point you brought up too about stigma and this idea that I feel like we hear it a lot that like if you're in a loving relationship, you can't get HPV, or only a certain type of people get HPV. And it's like you said earlier, again, like we know that basically everyone gets it, and it's just a matter of monitoring it and kind of destigmatizing how common it really is.
Yes, I look back and I think of all the women that I've known that had their uterus removed back in the day, or had this radical hysterectomy back in the day. There was no mention of HPV because we didn't know anything about it back in the day. But HPV has been around forever. And we've been exposed to it forever. I feel like so it can happen to anybody. I had this conversation actually with one of my best friends, and she believed that, well, her daughter didn't need to be vaccinated because, well, she was a Christian and she would be married to her boyfriend whenever that happened, and that would be her only guy, and that would be it. But we don't know that. We don't know that for sure. We don't know. HPV can be transmitted by skin to skin intimate contact. It doesn't even have to, the act doesn't have to even be completed. There doesn't need to be any penetration for HPV to be transferred from skin to skin intimate contact. So unless you can guarantee that that boy has never, ever, ever had any type of intimate contact, you cannot guarantee that your daughter won't be exposed. And just realizing that is what helped her make the decision that, hey, it really can happen to anybody. I will vaccinate my daughter. And so she did.
I think that's a really important point too, is that I think a lot of times we talk about barriers to STDs or like ways to protect ourselves during sex, but that even using condoms, HPV can still be transmitted because of the skin to skin contact. So even if people are working to prevent pregnancies or STDs in one way, it's still really important to get vaccinated to protect your.
Absolutely. Absolutely. A condom is going to prevent other things, but unfortunately, it's not going to prevent HPV transmission.
Well, thank you so much for speaking with me today and for sharing your story and for all the great advice you're giving to everybody. And just thank you so much.
Oh, thank you so much for having me today.
Thanks.